The fate of 91 healthcare workers contracted under the Global Fund TB program remains uncertain following 15 months of service without pay. The program, which began in 2009, ended in December 2023 with the understanding that the Ministry of Health and county governments would absorb the staff into public service. However, the Council of Governors has since stated that counties lack the financial capacity to take in the workers, leaving them in limbo despite years of dedicated service in the fight against tuberculosis. Helen Aura with more.
The Global Fund program for HIV, malaria and TB, which started in 2009, saw healthcare workers from different cadres onboarded in national and county facilities to run the TB, HIV and malaria clinics and laboratories. The program was to end in 2022, but the Ministry of Health, through the then Principal Secretary Susan Mochache, wrote to Global Fund seeking an extension of the program. Global Fund agreed to extend it until 30th December 2023. Healthcare workers under the HIV and malaria program were absorbed, but some TB healthcare workers were not.
In the TB program, we were 116 of us. 91 of us are left hanging. The rest were picked. Those were the ones who were working in the national facilities. They were absorbed. The rest of us, the 91 of us, we are working in county facilities. We are left.
A letter by Public Health PS Mary Mudhoni dated 26 July 2024, addressed to the Council of Governors, relayed a letter from the Public Service Commission granting conditional approval of appointment in the Ministry of Health in respect to Global Fund staff whose financing under the Global Fund ended on 30th December 2023, pending formulation of a transitional framework with counties on their absorption. The aforementioned conditional approval by the Public Service Commission required the Ministry of Health to initially remunerate all the Global Fund staff for a period of 6 months with effect from 1st January 2024. The letter goes ahead to say the purpose of this letter, therefore, is to inform you that we have remunerated all the staff under the Global Fund for the initial 6 months with effect from 1st January 2024 and consequently forward the list of staff domiciled in the respective county governments to facilitate their absorption by the counties with effect from 1st July 2024. A letter dated 27th September 2024 from the Council of Governors to the Ministry of Health cited, and I quote, "County governments require additional budgetary allocation to be able to absorb the additional staff and provide for their salaries, pension and all other benefits. The required amount is approximately 136,310,040 Kenya shillings, and this budget is currently with the ministry."
I'm financially down. Now even I have my daughter who is having a chronic condition which needs medication monthly. I need like for 1 month, I need like 16,000, which I cannot afford.
We are working in a hostile environment because we are working with our counterparts who are civil servants who actually receive their salaries, and now that we are the people who are working on contract, we are left with most of the work because you don't know your fate.
As the push and pull ensues between the Council of Governors and the Ministry of Health, Treasury is also yet to release the funds for absorption of the 91 employees who now say they are continuously being pushed to the wall each day despite their dedicated labor. Helen Aura, NTV.